So that actually this is a very critical year for the Sri Lanka, because as a global trend, WOHA and all the organizations plan to eliminate rabies by 2030. Sri Lanka also one of the country. So that we also plan some activities throughout the year. The first initiation from WOHA and Rabies Mission with the collaboration with Department of Animal Production and Health. We organize 2 weeks workshop in February, initiation in this year. That is on mass dog vaccination and also dog surveillance. And after that, last month, we organized another workshop with ICAM, that is on virus circulation and dog vaccination, how we implement it in the correct way. This is a third forum for all the participants, all the stakeholders are here. Actually, this is a good forum for us all, we can learn from experts from throughout the world. Here we have ICAM and Rabies Mission and POVOS and other all organizations visited to Sri Lanka to conduct this training program, 4-day workshop. Actually, all experts from the Department of Animal Production and Health and the Ministry of Agriculture, all the experts, we welcome you all, and also other organizations from animal welfare and the Department of Animal Production and Head Office, and also provincial councils and municipal councils and Sri Lanka Veterinary Association and SCAP-SL and other all organizations. We welcome all you to this program. So initiation as a Sri Lankan tradition. First, we would like to start our program, initiation for the lighting of oil lamp. So I would like to invite chief guest as a guest to participate this occasion. First, I will invite Dr. Sanjika Pereira, Director General, Department of Animal Production and Health, and Dr. P.S. Siri, Additional Secretary, Minister of Agriculture, Chairman, NLDB, Dr. B.C.S. Perra, and SLV President, Dr. Sugat Pemachandra, and the ICAM, Dr. Eli, and Dr. Roshani, and also Municipal Council, Municipal Commissioner from under North Central Province, Dr. Ruwan Vikram Vijayasinghe, and Director Public Health Veterinary Service, Dr. Niroshan Kamage, and Dr. Eric, and Dr. Soba Vichekon.
Nadu. Good morning, everybody. On behalf of the Ministry of Agriculture, Livestock, Land and Irrigation, it's a real privilege to welcome you all to the inauguration of the Leap Dog Workshop. We are proud to be hosting this here at the Tamarind Tree Garden Resort, organized by our Department of Animal Production and Health, working closely with the International Companion Animal Management Coalition, ICAM. Before we go any further, let me take a moment to recognize the guests with us today. Our chief guest, Dr. Sanjika Perra, Director General, Department of Animal Production and Health. I would like to welcome him this very important occasion. To our partners from ICAM, who have brought such valuable expertise to this initiative, welcome. ICAM Group, I would like to welcome by name, is Ellie, I don't know Miss or Mrs., so I apologize that. Eric, Mr. Eric, Mr. Patrick, and name-wise also my pronunciations are what it bit difficult. Sorry for that. And other group members, Patricia, Roxanne, Ruth, Simons, Tash. I would like to welcome all this ICAM group for this very valuable occasion. And all other directors from the Department of Animal Production and Health, and all the colleagues from Personnel Secretariat, the Ministry of Finance, Ministry of Environment, Ministry of Health, our Dr. Niroshan, Director Health in Public Health Division, and all other their groups, I would like to welcome this occasion. And from the everyone from the Ministry of Local Government and our provincial department, DAPH provincial department representatives, subject matter specialists, and all things, I would like to all persons, I would like to welcome you all. And our chairman, NLDP Dr. BCS Perra, I would like to welcome you, sir, that you are also very valuable person for this occasion. You are guide us and you make this fruitful event. And to the Ministry of Media, the Ministry of Education and Clean Sri Lanka program also, their representative also I would like to welcome for this occasion. And of course to the professional bodies who do so much of this work on the ground, the Sri Lankan Veterinary Association President, Small Animal Companion Practitioner Sri Lanka, the State Veterinary Surgeons Association, our President also present here, and Association of Veterinarians for Human Management and Animal Population, welcome you all for this occasion. If I haven't mentioned you by name, please know your presence here matters just as much. Just look around this room. The sheer range of people gathered here tells you everything about how seriously we take this as a shared national responsibility. Now to the reason we all here LEAP, the logical evaluation and action plan for dogs, is about taking a smart data-driven approach to managing companion animals. As Sri Lanka works to eliminate rabies and improve animal welfare, workshops like this one gives us the practical human tools we need to actually get there. And if there one thing I know for certain is this managing animal population isn't job for one department alone. It's take a village, it takes central and provincial government, veterinary professionals, civil society, and international experts all rowing in the same direction. That's why we gathered here. So let me say in sincere thanks to ICAM for their ongoing technical partnership and to Dr. Chamit and the whole DAPH team for bringing this workshop to life. Over the next few days, through the 16th July, the real work begins, and that work is I am confident the discussion in this room will turn into a clear, realistic action plan that our local authorities can put into practice. Our ministry stands fully behind you. We are committed to backing your ideas and to turning what comes out of this workshop into long-term national policy. Thank you all for your time, your dedication, and your expertise. I wish the Leapdog workshop every success, and I look forward to seeing its impact spelled across Sri Lanka. Thank you very much, and welcome again.
Bowen. It's an honour, really, to address this audience today. I would say that this week is a rare and precious opportunity. I think that we stand at the start of a new phase for the dogs and people of Sri Lanka, and that's been created by new leadership for the country, but also a renewed empowerment of the veterinary community for managing the dog population and for rabies elimination. Thank you. I'd say this is a golden opportunity. There are going to be challenges, but the need is great, and I feel that the timing is really perfect. So I've come this week with a team of facilitators led by Dr. Eric, but also there's a wider group of international experts who help to design the tools and the materials that we'll use this week in the workshop. So we bring experience and lessons learned. Some of those lessons are hard lessons. They're learned from our failures as much as our successes. Between us facilitators and the wider Leapdog development team, we represent every continent. But what we develop here this week has to work for the unique and special environment that we have in Sri Lanka. So we come with humility. So this morning, when we stood in our circle together and we looked around the room, we could see that we are rich in local expertise, a deep knowledge of dogs and people in Sri Lanka. And the wisdom will come from that combination of international expertise and local knowledge and expertise. We are greater together than the sum of our parts. So I'm grateful and I'm honoured to have this opportunity to work with you all. And I believe we will create real change that starts today. So the hard work of managing dog populations in the field falls to local government and local organisations. So the sterilisation, vaccination, rescue, responding to complaints, responding to rabies cases, enforcing legislation, supporting people to be better owners. But those local actions happen within a wider national framework of legislation, of policy, of training, of capacity building, standards, access to veterinary drugs that you need, funding, social norms and social expectations. That national framework is critical and it's powerful. So it can create a supportive environment, or often unintentionally, it creates barriers. And it leaves local actors circumventing a framework that's inappropriate, that's out of date, and that's unhelpful. So, to those of you doing the important and difficult job of implementing dog population management in the field, be thinking what gets in your way and what could make it easier. Because this week, our Leapdog workshop will focus on that national framework and the actions that we can take to build it. Building a framework that sets a strategy, that gives direction, but it also empowers local actors to make their own decisions. And it builds capacity that truly enables local actors to manage dogs effectively. The DPM, the Dog Population Management System, is permanent. This is not a 3-year project with an end point. This is a permanent system that evolves over time. Every country has a DPM system. The system in the UK looks different, and it should do, because the DPM system has to reflect the dog population dynamics and the dog ownership practices of the country. So what we establish this week will be the most effective and efficient system for Sri Lanka, and one that respects animal welfare. This will be a humane solution. Most important for an efficient system is that it works on the root causes of the sources of unwanted dogs, not only the symptom of the current stray dog population. So I'm going to ask you to imagine something with me. Imagine that dogs could talk, and we went out onto the streets and walked along the streets, and every free-roaming dog that we met, we asked them a question. Where did you come from? Some dogs would say, oh, I was born here on the streets. Others will say, I'm owned, I've got a home, I'm just roaming with my buddies. Others would say, I used to be owned, but my owners don't want me anymore, I've been abandoned. And then others would say that I am lost. I have an owner that wants me back if I could just find my way home. If we only work to remove today's stray or free-roaming dogs from the street, whether that be through culling, as done in some less compassionate countries, or through shelters, we would only be working on the symptoms. The dogs that were removed would be replaced through breeding and roaming and abandonment and loss. And those populations of dogs would rebound. And that's where expensive and ineffective stray control lives. It's like endlessly mopping the floor while the roof is still leaking. So culling of stray dogs in Sri Lanka was stopped many years ago by a movement of people within this country from the roots of compassion that run deep within your culture. From those same roots comes the action of sheltering dogs, and for those individual dogs, that's rescue. In the West, shelters are part of our DPM system because our intake is low and rehoming is high, so dogs leave as fast as they arrive. But here, when we look at DPM on a national scale, with 2.5 million dogs, the maths of sheltering just doesn't add up. Intake is too high, and rehoming is too low. Shelters fill up, the shelter has to keep the dogs long term, and that's a huge cost, and they can't take in any new dogs. So this week, we're going to look at sources. Where do those dogs come from? And what can we do at the national level and at the local level to address those sources? Reducing the free-roaming and unowned population through means other than shelters, and certainly not through culling. So looking at sources, we recognise that this is as much a human issue as it is a dog issue. Dogs are not wildlife, they are a domesticated species. So what owners, carers and feeders do with those dogs influence their dog population dynamics. They are the root of the sources. So we must address human behaviour. And through more than just education or awareness and enforcement. Knowing what you should do and knowing the law does not mean that you will do it. How many of you broke the speed limit on your journey here? So behaviour change is a recognised discipline, internationally and here in Sri Lanka, so we'll be exploring how national actions can support human behaviour change using the knowledge within that discipline. We'll also look at how national policy can give technical guidance to local implementation. When we use an expensive but highly influential intervention like sterilisation, we need to do it wisely, targeting to best effect. So we will discuss together female dog focus. Females set the rate of population growth, and when in heat, they trigger problematic male behaviours. Sterilisation can also help eliminate rabies. But vaccination of free-roaming dogs, consistent across space, no gaps, no GNs missed, using a highly effective vaccine, giving 3 years of immunity, that is the foundation of rabies elimination. We do not need to sterilise every dog that we vaccinate. But where populations turn over quickly, where the death rate is high, where the birth rate is high, herd immunity is challenged. So we can look to maybe sterilise those females whose puppies are free-roaming and unlikely to be vaccinated by owners or carers. And by doing that, we can help keep herd immunity high, leaving the rabies virus nowhere to live. So I thank you again for your leadership and your confidence in our ability to come up with a good solution this week. I want to thank my facilitators for travelling here to share your knowledge, but also coming with an openness and a genuine excitement to step back and let the local experts lead. We're going to learn a lot from you this week. And most of all, thank you to the participants who have taken 4 days off work to come here from across the country. Through this week, we're going to become collaborators, we're going to become friends, and we're going to create a path forwards to a better future for both dogs and people together. So thank you.
But thank you for upgrading me. Thank you, Ellie, and thank you everyone for the welcome that you've given us and for the trust that you're placing in this process. I want to start by sharing something personal because it explains why I would not have missed this week for anything. I first came to Sri Lanka just over 20 years ago, and for a couple of years I lived in a small rural village of only 42 families. I remember the streets with many dogs on them, but the sense that people cared deeply about the animals but had so few tools, resources, and so little system around them to be able to turn that care into change. The country and its people had so many challenges to contend with. But 20 years is a long time, and when I look at what has happened since, the end of culling, the growth of a skilled and committed veterinary community, the sterilisation and vaccination work already underway across this country, I see a nation that's been quietly but steadily building towards this week for 2 decades. When I say that this is a golden moment, I do not say it lightly, and I don't say it as a kind thing that a visitor might say. I say it because I've seen the years of groundwork that make it happen, and many of you are here today. A new government bringing renewed energy and political attention to this issue, a veterinary community ready to lead, and a clear shared ambition to eliminate rabies and to keep Sri Lanka free from rabies for good. This is not small ambition. Very few countries in the world have both achieved and sustained this. Sri Lanka has the foundations, though, the compassion and now the momentum to be one of those. Let me say a few words about why this matters to Battersea. Battersea's strategy is not to run dog population management programs ourselves. Our strategy is to scale humane, sustainable population management by standing alongside governments, veterinary sectors and civil society to actively support a pathway to national ownership, so that what is built endures long after we've made our little contribution. We have learned that countries where this work truly lasts are the ones where government owns it, where the legislation, the funding, the training, the political will belong here, not with any international partner. We're here just to facilitate. An NGO can run a great project, and many of them are, and we see so many impactful efforts that are ongoing, but only government can build a permanent system. At Battersea, we also want to support what people genuinely care about in the focus countries that we support. ICAM's recent survey work that was done across Mexico, Turkey, the Philippines, although different countries, the patterns we're able to generalise from those patterns. And that research found that 74% of urban residents rate government responsibility for managing free-roaming dogs as between 8 and 10 out of the 10 most important things, on par with things like street cleaning, road repairs, public transport, in the list of public stated priorities. Dogs are no longer a concern of the small number of passionate individuals. Dog population management is understood as a key public service. The same research also found overwhelming rejection of culling and near universal public willingness to fund this through local taxes. DPM is so much about the people behind the dogs. This survey also found that communities are currently absorbing most of the day-to-day care burden. But when the government steps in an organised, resourced way, it's filling a gap that ordinary people feel acutely and have been carrying alone, often with financial struggle. However, in the current context of high need, external funding will be necessary to support government to a point where it can fully financially and politically absorb the activities, and Battersea is really excited to explore how this can work. Sri Lanka is on a new trajectory. Through veterinary sector jobs, civil society employment and tourism, a national commitment turns DPM into an economic development lever, not just a welfare spend. But improvements in the lives of humans and animals doesn't happen by chance. It takes concerted effort to see the difference. But we know this won't be a walk in the park. We often talk of governance gaps, such as fragmented responsibility across departments, private sector, NGOs and volunteers with no clear accountability. These are one of the primary reasons that DPM efforts fail globally. A government stepping in to hold that coordinating role directly addresses this single most common point of failure documented worldwide, most often between human and animal health departments. This week's work and the action plan that emerges belongs naturally inside Clean Sri Lanka. The Clean Sri Lanka initiative asks us to look again at our public spaces, our streets, our beaches, our marketplaces, and ask us what truly clean, dignified public space looks like. A street free of litter, but full of visibly suffering animals, is not yet the vision this initiative describes. Clean Sri Lanka's social sustainability pillar speaks of community empowerment, and dog population management is exactly that, because it puts the tools of care back into the hands of people already feeding and looking after these dogs on a day-to-day basis. The President spoke of restoring the social and environmental fabric of this country. Few things sit more literally at the intersection of the social and the environmental than how a nation manages the animals living alongside it in its public spaces. So my hope for this week is simple. I hope you leave feeling that this plan is yours, and that we collectively leave knowing how to help dogs and people live well together and rabies-free. 20 years ago, I can imagine that we would be in this room together, so I'm deeply grateful to be here now, to work alongside you and to watch what Sri Lanka builds. Thank you.
Dr. Sanjika, Director General, DAPH, and Dr. P.S. Hiri, the Additional Secretary for the Ministry, and the gentlemen and ladies from the ICAM and other associations. And at the same time, I mention about the other government officials from various ministries and the distinguished other guests. Actually, with many explanations and many valuable speeches, I just thought to listen to them. Anyhow, Kumaralwa wanted me to have a little speech. Actually, I don't want to talk much. I will just inform few informations, few messages to this audience. If I and the society understands in future, if we want to have a rabies elimination from our country, at the same time have a proper state of population control. This is the real audience. Dr. Eric and the other ICAM ladies and gentlemen, I should stress to say this. This is the people, this is the set of professionals who can achieve this endeavor. Actually, this should be. Very recently, we think this new government will take measures to hand this rabies control program and at the same time state of rabies control program to these hands. Actually, then only we think the success of this rabies activities, which is very important to our public health sector, will be taken place. I think it is our hope. At the same time, I should inform for this valuable and important occasion, the Minister of Public Administration and Local Government was supposed to come. Due to very important and urgent issues, he had to attend to a meeting at the President's Secretariat. So he mentioned me that he would, he expressed his favor to meet the ICAM gentlemen and ladies within your mission within this one of the days, probably if you are okay on 16th evening, he said that he would have a time to have a dialogue with you regarding the rabies eradication program. Actually, he and the government actually should be very grateful for your valuable contributions in this regard. Actually, these training sessions, these awareness programs will have a real fruitful result in future. So I think in these countries, near future, will have a very, very important and very, very needful programs in veterinary public health, especially rabies eradication and state of population control things. So I won't continue my speech further. So again, I should be very grateful and thankful for the people from ICAM and other organizations contributing to this program. At the same time, I should be thankful to Dr. Chamit, who takes the mainstream stronghold in this program and take the most activated leadership for this program. So I wish all success of your endeavors. Thanks.
Good morning, and I will be very brief because you have listened to a lot of speeches now. I think Eric energized you. I think now its energy is going down. First of all, I would like to thank the ICAM and Better See and Purpose people, all the doctors and experts, for selecting our country as a destination for you to give your expertise and to see this menace is going to be end. And if you know the poem Ravan, which is written by very famous poet called Edgar Allan Poe, who was a states nationalist. And he was the one who has claimed to be died of rabies as the most famous person. We really don't know because he died in 1845. There were no scientific evidence there, but the people claim, they go through their post-mortem reports and medical history and they say, okay, he may have died from rabies. And if you have seen the statue in Colombo, near Eye Hospital, in the roundabout, there's a statue of a very famous philanthropist, Charles Henry de Souza. He died in 1885, and the evidence was very clear. He was bitten by a dog and died because the people suggested him to go abroad and get some treatment, but he opted to stay here and get treated by the native doctors. So he died. He's one of the most well-known philanthropist, and he has donated all his property to other people, hospitals, schools. Okay, so those people's life was cut down very abruptly by rabies. To imagine the dog was, been a companion of the human beings for more than 30,000 years. Maybe I'm wrong. But can you imagine the, agony of the people without having a treatment for this rabies? They're biting always and people are dying with such a terrible disease. So it's great time now we have to, end this Sri Lanka. And we know we have all the potential. We have all the resources. Being island, we have our advantages also. And if I am correct, we started this vaccination of dogs in 1954. Yes, 53. And as a campaign, it started in 1973. Am I correct? Yes. So from 1973 up to today, this has been going on, vaccinating dogs, campaigning. And what is happening is, I don't blame, we have achieved a lot, but still we have a lot to achieve. Still, I think in 2026 or 25, it's 16 deaths. 14 deaths. So in 1973, this campaign was started because we have somewhere around 377 deaths. So we, to be honest, we kind of failures in that regard. We are not blaming Ministry of Health or Dr. Roshan. He's not responsible, but somehow or the other we have to, get rid of the. In a very personal note, I was the, how do you call it? The person, the oldest person who has witnessed the rabies campaign because my father was a PHI. And I used to go with him because there are no vehicles. Whenever he comes with the vehicle, I, get into it in 1975. So I have witnessed, so it's a personal note. I was not going to, talk about technical points. You are going to hear it in the coming 4 days, including today. I will just wanted to emphasize certain things. The rabies vaccine or the rabies has, changed the human history because the scientific studies based on rabies has changed our medical history because people need to have some cure in 19th century. So they developed rabies vaccine along with other vaccines. So we know it's 100% mortality but 100% preventable. So luckily we have a new legislation now. We have get rid of our old registration of dogs ordinance and rabies ordinance, and we have compiled a new one. And with that new one, most of our veterinarians, and you are empowered. It has been given to you as a personal responsibility to eliminate rabies. You have to work for it. So it's a responsibility now. So most important thing is to remember here that you can't eliminate rabies by your own. So I believe in interdependency. Okay? You always have to work with medical authorities, local governments, the facilitators, donor agencies, even the community. Okay? Without the community's assistance, you may not achieve. Because every person should feel that they have a responsibility of their pets. So that is the starting point. So you have to remember from now on, after this 4 days session, you will be not only trained, but you are trainers of other professionals. So keep in mind, together we can achieve more. And by the end of 2030, perhaps we may achieve our target. But it's all right if it is dragged for another 5 years, because we have waited for some 70 years. So thank you very much. I hope I didn't bore you. Thanks.
I represent Minister of Health, but I'm a veterinary surgeon. I got a lot of experiences in rabies control in the country and how we are going to collaborate with others, other stakeholders, how difficult it is. And I've been trying to bring all the parties to one table. It is very difficult. I used to say that it is very difficult than controlling of rabies in the country. Anyhow, I have a small thing to show you, because graphs have thousands of words, because I would like to say a few words. And I want to show this one. And this is the rabies control in the country, starting from 1970 to 2025, what has happened to the country. And yes, up. My topic is that it's difficult to show you. Anyhow, that is from crisis to control. If I summarize I'm sorry, the head table cannot see that one, luckily. Then I will say. If I summarize the past history of the rabies control in the country, the death toll has come to 14 deaths. 2025, we have had 14 deaths, and in 1970, it was around 400. 1973, it was around 377. It's a remarkable achievement, 95% reduction in deaths, human deaths. If you look at the vaccination, a few 100,000 vaccines in beginning of this campaign. Now, last year, we have done 1.69 million vaccinations. And the human rabies vaccines, if you look at, it was around 500,000 doses for human rabies. Now it has come down to 100,000. We saved a lot of money to the country. And this time span is 55 years, starting from 1970 to 2025. If you can look at the first graph, it's about the human mortality trend. It has come down very tremendously, starting 400 odd number of deaths to 14 deaths, 95% reduction. And if you look at the green bars of the second graph, the vaccination, how it has happened in the country. Gradually it has gone up, and starting from a few 100,000 to 1.69 million, we have given priority to the vaccination, and vaccination is there. Unfortunately, you can see a drop in 2017 and 2018 because of anyone's fault. The PHVS does not have official data of that year. Oh, right? It is not our fault. The other graph. The third graph shows how we use ARV vaccination for human, and we had 500,000 doses per annum in past years. Now it has come down to 100,000, nearly 100,000 doses. The last one shows the vaccination versus mortality. Vaccination is going up, the human deaths are coming down. When we look at these graphs, you may understand that we are at the last mile of elimination. Ladies and gentlemen, this is the most difficult thing. running in the last mile of this marathon is the very, very, very difficult thing. It is not that easy. We have to understand it is a very difficult task. We need support from all other stakeholders. The PHVS, the National Anti-Rabies Campaign of the Ministry of Health, cannot alone achieve this target. We need the support of other stakeholders, other well-wishers, other NGOs, and other funding agencies, technical people, and this must be a collaborative and collective work. Finally, I would like to say, the PHVS, Public Health Veterinary Services of Ministry of Health, we have had a strategic plan for 2030, 0 by 2030. We are aiming that one. We have a strategic plan. Now we are working in that plan. We are in the plan. We have activity plan and action plan. We are in that actions at the moment. Looking 0 deaths in 2030. Sometimes it may be too ambitious, but we can achieve. We have sustained plan from 2030 up to 2042, how we can sustain if we achieve elimination status. It is also a difficult thing. We have idea, very clear idea, how we can sustain the elimination status up to 2042. We have that clear picture with us. And finally, I would like to say, if this is a challenge, we are ready to take that challenge. We have very good comprehensive plan, as Dr. Nalnika said in the morning, execute a workable plan. We have a workable plan. Now we are in that plan. Unfortunately, the support from the other stakeholders are very low. We are trying to get the support from the other experts and the other stakeholders and other people, other experts, and the other countries, those who are having success stories, we would like to share, we would like to get their experiences and absorb them into our program to achieve our targets. Finally, again, I would like to thank organizers, Dr. Chamit, for inviting PHVS to this opportunity. And I would like to, finally, I would like to say, we are ready to take this opportunity. If this is a challenge, we are ready. As PHVS and as vet profession, we are ready to take this challenge. We are ready to lead the campaign.
Animal Production and Health, Additional Secretary of the Ministry of Health, representative of the International Companion Animal Management and Coalition, ICAM, distinguished guests, government officials, veterinary professionals, local authority representatives, and all participants of this moment of workshop. First of all, I would like to express my sincere gratitude to the Department of Animal Production and Health, International Companion Animal Management Coalition, for the organizing this valuable Leapdog workshop, for invitation me to share my thoughts at this moment of occasion. The management of stray dog and the responsible dog population control have become significant challenges for many countries around the world. Sri Lanka is also facing the challenge, and it is requires a scientific, human, and sustainable approach to rather than temporary solutions. As a local government authorities, we have a special responsibility in management in public health, environment cleanliness, and the safety of the well-being of the community. At the same time, we must ensure the animal welfare principles are respected. I am very pleased to mention you that during my tenure of the Municipal Commission of Anuradhapura Municipal Council, we successfully implemented dog deserialization program as a practical approach of managing the stray dog population within the municipal area. This program was carried out with the cooperation of veterinary professionals such as Dr. Chamit Nanakara from Vet for Future, government institutions and the stakeholders such as Justice for Animals. The experience gained from that initiative initiative clearly demonstrated that the sterilization is the one of the most effective humanitarian method controlling the dog population. It is reduced the uncontrolled breeding, improvement of animal welfare, and contributes towards the reducing the public health risks associated with the stray dogs. Based on that experience, when I assumed duties as Provincial Commissioner of Local Government of North Central Province, I recognize the importance of expanding this concept beyond the single local authority. Therefore, under the 2026 Provincial Special Development Grant, normally we know PSDG fund, we initiate first pilot dog sterilization project conducted under the Department of Local Government in Sri Lanka. The pilot program is a significant milestone because it creates the model of collaboration between provincial authorities, local institutions, veterinary surgeons and animal welfare organizations. Through this initiative, we aim to develop a systemic and evidence-based approach for dog population management throughout the North Central Province. I would like to appreciate commitment of the Department of Animal Production and Health, ICAM, veterinary officers, local authorities, and the whole organization in order to promoting human dog population management in Sri Lanka. Finally, I wish this workshop very successful and hope that the decisions, experience, and the recommendation developed here will contribute toward the creating healthier community and compassionate environment of both people and
Director General, Department of Animal Production and Health, and other representatives from government officials, government institutions, representative of ICAP, and all other distinguished guests and participants. Good morning. On behalf of Minister of Environment, it's a privilege to participate in this inauguration occasion of the Leap Dog workshop. So, as we gather here, we are addressing an issue that lies the core of our shared environment, the coexistence of human communities and companion animals. In the Ministry of Environment, we do not view animal welfare as an isolated manner. It's deeply connected to ecosystem health, public hygiene, and our national biodiversity landscape. So mismanagement stray animal populations put immense pressure on local environments and public health resources. And recently government also taken remarkable actions approving the animal welfare bill. So it may also lead this Leap Dog framework may step towards sustainable and data-driven solution. And as the Ministry of Environment is ready to give its fullest cooperation to Department of Animal Production and Health, so let us collaborate to ensure that compassion, environmental safety, and scientific management for a more human Sri Lanka.
Thank you, ICAM, for selecting Sri Lanka for this workshop. Dr. Sanjika Pereira, Director General, Department of Animal Production and Health, and other dignitaries in the head table, dear doctors, government officials, ladies and gentlemen. It is a great honor and privilege for me to represent Sri Lanka Veterinary Association at the inauguration ceremony workshop on developing Sri Lanka's National Dog Population Management Plan. First of all, I would like to congratulate the organizers for bringing together such a distinguished group of experts and stakeholders. This workshop is much more than a meeting. It is an opportunity for all of us to work together towards healthier Sri Lanka, a safer Sri Lanka, more compassionate Sri Lanka. Sri Lanka Veterinary Association is the premier professional body representing veterinarians in our country. Today, our association comprises more than 1,500 veterinarians serving both government service and private sector. Our members also contribute through universities, research institutions, livestock development, companion animal practice, wildlife conservation, veterinary public health, and many other sectors. Because of this wide professional representation, Sri Lanka Veterinary Association is uniquely positioned to contribute scientific knowledge, technical expertise, and practical field experience in national programs like rabies control program. Sri Lanka has made tremendous progress over the past several decades. These achievements have been possible because of the dedication of veterinary professionals, medical professionals, public health authorities, local government, and many other partners, especially animal welfare organizations, support team. We must also address this issue of dog population management in a scientific, humane, and sustainable manner. For many decades, Sri Lanka Veterinary Association has actively supported national efforts in rabies prevention and control through professional advocacy, continuous veterinary professional education, technical expertise, public awareness program, and close collaboration with government institutions and other stakeholders. Sri Lanka Veterinary Association firmly believes that successful dog population management must be science-based, humane, sustainable. Because of managing dog population is not simply about reducing numbers. It is about improving animal welfare, protecting public health, preventing rabies, supporting responsible dog ownerships, and creating communities where people and animals can live safely together. On behalf of Sri Lanka Veterinary Association, I extend our fullest support to the development and implementation of Sri Lanka's National Dog Population Management.
Director General, Department of the Animal Production and Health, Dr. Sanjika Pereira, and all the distinguished guests and speakers, and also all the invitees. So I'm from ACAPSL, Association of Companion Animal Practitioners of Sri Lanka. So we represent all the practitioners in Sri Lanka, island-wide. So actually, after several talks, speeches, so we all know the history, so we all know what happened, and so now I think we are working towards to make this story to an end. So as ACAPSL, as an association, so we have actually given our full commitment to eliminate eliminate rabies, and to that working towards to end rabies by 2030. So actually, before Dr. Sanjika Pereira appointed, so we discussed with Dr. Hemali Kothalawala as well, a couple of, I think 1.5 years ago. So we wanted everybody to, come into one platform and work together. So and after Dr. Nidarshan appointed as the director of PHPS also, we as an association discussed how this should be operated as you all mentioned, collective and collaborative way. So we ACAPSL actually, I know that we all know that we have in our different capacities, we have worked in different levels. So we ACAPSL also have done so many activities in related to the rabies elimination. So just to mention few, last year, so we dedicated our whole year to do more activities on rabies elimination. So we in parallel to the World Rabies Day, 28 September 2025. We did a one-day island-wide the model program. So we did 163 points vaccinations, more than 10,000 vaccinations in one day, island-wide, and 68 public awareness programs, and 10 plus surgery programs, nutrient programs. And not only that, we invited Dr. Eric as our keynote speaker last year, as a guest speaker. So we also have done so many activities. So you also, and I mean that all the stakeholders have also done so many activities, but in different capacities and different platforms. So we always try to be in one platform, and we are fully committed, as I mentioned. Once actually we, not the Dr. Sanjika Perera, we asked Dr. Hemali Kottalawala that if it is possible, make available rabies vaccine free of charge in the entire country. So we as an association, we will drive our members to vaccine all the dogs and cats. So if it is available free of charge, so we will be able to cover more. So actually, so we, even that way, sacrificing because you know that the association is with all the members who are doing their practice, but committing that and even sacrificing that also, so we try to get involved into this program. So I think this is as you all mentioned, this is a golden opportunity, but as Dr. Niroshan correctly mentioned, this is the hardest hour. But as I can see, all the stakeholders are on board in one platform. So I think this is but it's not an easy thing, but it's not an unachievable thing. So I think this program today and tomorrow, 3-day program also will help to that. And without stopping there, we all must work towards to end rabies by eliminate by 2030. And we also have one dream, at least to see 0 deaths, no rabies, free rabies country in our era. So thank you very much. And also as a ACAPSL, we will be fully committed to the program that you will be conducting in the
and Additional Secretary Dr. P.S.Siri and Dr. B.C.S. Perera, Chairman NLEB, and Dr. Niroshan Gamage, Director Public Health Veterinary Service, Minister of Health, and Mr. Ruwan Wijayasinghe, Commissioner Local Government, and Ms. Padma Bulasingala, Environment Ministry, and Dr. Sukat Pemachandra, SLVA, and Chatura Piyadasana, SCAPEL, and our Dr. Mudita Kodituaku, Director Veterinary Regulatory Affairs, and all the SMS from all the 9 provinces, and Deputy Directors, Veterinary Surgeons, and all experts from international organizations, especially for thank this program sponsors by Ms. Betisa and Betisa organization and ICAM. I think with all the participants, I would like to thank all for participating for this 4-day workshop. Now we end of our inauguration ceremony. Coffee break is ready to outside. You take 15 minutes and after that we can meet again. Thank you.
අද කියන්නේ අපි ඇත්තටම ඊයේ හවස් තමයි පටන් ගත්ත මේ වැඩසටහන දවස් 4ක් පුරා මේක දිවෙනවා. මේකේ ප්‍රධාන අරමුණ තමයි මේ අපි කියන ජලබීතිකා රෝග මර්ධනය සඳහා ගන්නා එක්තරා පියවරක් හැටියට කොහොමද සුනක ගහණය මානුෂීය ආකාරයෙන් පාලනය කර ගැනීම පිළිබඳව වැඩමුළුවක් තමයි පවත්වන්නේ. එතකොට මේකෙදි ඇත්තටම කරන්නේ කොහොමද ඒ කියන්නේ වීදි සුනකයන්, එතකොට අපි කියන අර සමාජ කමියුනිටි ඩොග්ස් කියන කට්ටිය, එතකොට තමන්ගේ ගෘහස්තව ඇති කරන මේ සතුන් සියලුම දෙනාම කොහොමද මොන ආකාරයකින්ද ඒ වන්ද්‍යාකරණයට ලක් කරලා නැවතත් අපි හිතමු දැන් අර වීදි සුනකයෝ නම් කොහොමද වන්ද්‍යාකරණයට ලක් කරලා ජලබීතිකා එන්නත ලබා දීලා නැවතත් ඒගොල්ලෝ හිටපු පරිසරයට මුදා හැරලා ඒ ආකාරයෙන් අපි කොහොමද සත්ත්වපාලන ගහණය කන්ට්‍රෝල් කරන්න කියන එකයි අර තමන්ට ඒ කියන්නේ විශාල වියදමක් කරගන්න බැරි හැකියාවක් නැති පවුල්වල සිටින තමන්ගේ සුරතල් සතුන් කොහොමද වන්දනාකරණයට ලක් කරලා දෙන්නේ කියන ඒ පණිවිඩ දෙක තමයි ඇත්තට මේකෙදි අපි කරන්නේ. මේකෙදි අපි ඇත්තටම සම්පූර්ණ තාක්ෂණ වැඩමුළුවක් යන්නේ. මේකට සහභාගී වෙන්නේ පළාත් දෙපාර්තමේන්තුව, සත්ත්ව නිෂ්පාදන සෞඛ්‍ය දෙපාර්තමේන්තුවේ පශු වෛද්‍යවරුන්, ඒ වගේම අපේ තියෙන අමාත්‍යාංශවල පශු වෛද්‍යවරුන්, ඒ කියන්නේ පළාත් පාලන ආයතනවල පශු වෛද්‍යවරුන්, ඒ වගේම විශාල අපිට මේකට උදව් කරන වෙනත් විදේශීය ආයතනවල පශු වෛද්‍යවරුන් සහ විශේෂඥයන් මේකේ සහභාගී වෙනවා මේකට. මේකේ අපි මෙහෙවන්නේ ඇත්තටම සත්ත්ව නිෂ්පාදන සෞඛ්‍ය දෙපාර්තමේන්තුව තමයි මේක සංවිධානය කරන්නේ. එතකොට මේකට තව ආයතන දෙකක් සම්බන්ධ වෙනවා, ICAM සහ Better See සහ POPOS කියන සංවිධාන කිහිප එකතු වෙලා අපේ දේශීය සංවිධානත් එක්ක එකතු වෙලා තමයි මේ වැඩමුළුව සංවිධානය කරලා තියෙන්නේ. ඒගොල්ලෝ ඇත්තටම කැප වෙලා ඉන්නේ ලංකාවේ ජලබීතිකා රෝගය තුරන් කිරීම සඳහා විශාල කැපවීමක් කරන සංවිධාන කිහිපයක් ඒගොල්ලෝ. ක්ලීන් ශ්‍රී ලංකා සංවිධානය තමයි ඇත්තටම අලුතෙන්ම මේකට නව ජවයක් ලබා දීම සඳහා ඉදිරිපත් සංවිධානය. ඒ කියන්නේ අපි ජනාධිපති කාර්යාලය මට්ටමින් පවත් තියෙන සංවිධානයක් ඒක. එතකොට මේකේ ක්ලීන් ශ්‍රී ලංකා සංවිධානය සම්පූර්ණයෙන්ම මේ වැඩසටහන පිටිපස්සේ ඉන්නවා. විශේෂයෙන් මේගොල්ලන්ගේ සිතුවිල්ල තමයි, ඒගොල්ලෝ හිතන විදිහ තමයි දැන් ලංකාවේ ඉන්න සුනක ගහණය, විශේෂයෙන්ම වීදි සුනකයෝ සහ කමියුනිටි ඩොග්ස්ලා කියන කට්ටිය පාලනය කරන්න ඕන සංචාරක ආකර්ෂණයට. එතකොට පරිසරයේ අපවිත්‍රතාවය නැති වෙන්න. එතකොට මේගොල්ලෝ අර අපි කියන වගකීමක් දරන පෙට් ඕනර්ෂිප් කියලා කියන්නේ සුරතල්ලුන් ඇති කරන්න පිරිසක් ලංකාවේ බිහි වෙනවා නම් ඇත්තට ඒක ක්ලීන් ශ්‍රී ලංකා කන්සෙප්ට් එක ඇතුළෙම තියෙන දෙයක්. හින්දා ඔවුන් මේ වැඩසටහන පිටිපස්සේ හරියටම ඉන්නවා. ඇත්තටම අපි වසර ගානාවක් තිස්සේ විශේෂයෙන්ම රාජ්‍ය නොවන සංවිධාන විසින් මේවත් පිළිබඳව සත්කම් වැඩසටහන්, එතකොට ජලබීතිකා මර්දන වැඩසටහන් සියල්ලම කරන නිසා සෑහෙන අපි කියන පාලනයක් සිදු වෙලා තියෙනවා. තියෙන ප්‍රශ්නේ මේකයි, එක ගැහැණු සතෙක් ඇති නැවතත් පසුගිය තත්ත්වයටමපත් වෙන්න. මොකද පැටව් 6ක් 10ක් අතර ප්‍රමාණයක් දානවා එකපාරට. යම්කිසි තැනක එක ගෑනු සතෙක් මගේ ඇරුණද එයා එකපාරටම ඊළඟ අවුරුද්ද වෙනකොට නැවතත් හිටපු ගහණයෙන් බවට පත් වෙනවා. ඉතින් මේකට විශේෂයෙන්ම තියෙන වැඩපිළිවෙල තමයි ඇත්තටම මහජනයා තේරුම් ගන්න ඕන. අපි හිතමු දැන් වීදිවල සුනකේ හිටපුවාම ඒගොල්ලන්ට අර කෑම දාන එක ඉතා හොඳ දෙයක්. ඒගොල්ලන් නිරාහාරව තියන්න හොඳ නැහැ. ඉතා හොඳ දෙයක්. හැබැයි ඒගොල්ලෝ ඒ සතුන්ගේ වගකීමක් ලබා ගන්න ඕනේ. මොකද අපි කෑම දුන්නාම ඒගොල්ලෝ දැන් වෙන්නේ මෙහෙමයි. දැන් කමියුනිටි ඩොග්ස් එක කට්ටියක් ඉන්නවා. ඒගොල්ලෝ ඇත්තටම අර අපි දාන කෑම වලින් තමයි යැපෙන්නේ. හැබැයි ඒගොල්ලෝ කාටවත් අයිති නැහැ. ඒ කියන්නේ පුදුලෙකට අයිති නැහැ. අපි පිටින් ඇවිල්ලත් මෙතනට කෑම දාන්න පටන් ගත්තොත් වෙන්නේ ඒ සමාජයේ ඉන්න පුළුවන් සතුන් ප්‍රමාණයට වඩා විශාල ප්‍රමාණයක් සතුන් බිහි වෙනවා. මොකද කෑම තමයි ප්‍රධානම සාධකය. හැබැයි අපි කෑම ටික දාලා ගියාට පස්සේ ඒගොල්ලෝ බලාගන්න, ඒගොල්ලෝ ලෙඩලට බෙහෙත් කරන්න, ජල බීතිකට එන්නත් කරන්න, වන්ද සැත්කම් කරන්න කවුරුත් නැත්තම් මොකද වෙන්නේ? අපි විසින් කරන්නේ හොඳ වගේ පෙවුනට යම් කිසි හානියක්. ඉතින් අපි හැම අපේ රටේ මහ ජනතාවගේ විශේෂම සුරතල් සතුන් ඇති කරන්නන්ගේ ආදරය කරන්නන්ට විශේෂයෙන් ඉල්ලීමක් කරන්නේ, Tamanට හැකියාවක් තියෙනවා නම් සතෙක් අරගෙන Tamanගේ නිවස තුළ ඇතිදැඩි කරගන්න. වීදි සුනකෙක් වුණත් කමක් නැහැ. හැබැයි වීදියේදී වීදිය මත තියාගෙන මේ සතුන්ට කෑම බීම දීමෙන් කරන්නේ ඔබ අගතියක්. ඒක නිසා අපි තාමත් ආදරෙන් ඉල්ලා සිටිනවා සියලුම පුරවැසියන්ගෙන් සතුන්ට ආදරය කරන්න, සතුන් තමන්ගේ පවුලේ කොටසක් බවට පත් කරගන්න. හැබැයි ඉරෙස්පොන්සිබල් එහෙම නැත්නම් වගකීම් විරහිත විදිහට යම් යම් දේවල් තමන් ආදරය නිසා කරන්න එපා කියලා ඉල්ලා සිටිනවා. 1973 වගේ කාලේ තමයි ලංකාවේ ජලබීතිකා කැම්පේන් එකක් පටන් ගත්තේ. ඒ දවස්වල 370 ගානක වගේ මරණ සංඛ්‍යාවක් තිබ්බා. ඒක ඇත්තටම මේ කාලාන්තරයක් තිස්සේ ඇවිල්ලා අද 14කට බහැලා තිනවා. මරණ 14කට. 10 වසරකට. හැබැයි 14 කියන්නේ පොඩි ගාණක් නෙමෙයි. මේ 14 මැරෙනකොට සතුන්ගේ අපි කියන්නේ සපාකෑම් සංඛ්‍යාව ඉතා විශාල ප්‍රමාණයක් තියෙනවා. හොඳ වෙලාවට රජයේ රෝහල් වල නොමිලේ දෙන මේ එන්නත නිසා බොහෝ පිරිසක් බේරෙනවා. දැන් අපිට උවමනා වෙලා තියෙන්නේ ඒක නරක වැඩක් නෙමෙයි. ඒක නරක වැඩක් නෙමෙයි. ඒක ඇවිල්ලා මිනිස්සුන්ව බලා ගන්න හොඳ වැඩ පිළිවෙලක්. හැබැයි අපිට ඕනේ වෙන්නේ ඒ බරත් අඩු කරලා. ඒ කියන්නේ අපි සියලුම රෝහල් වල විශාල රෝහල් වල හැම කෙනෙකුටම ඒ කියන්නේ බල්ලෙක් සපා කෑවොත් පූසෙක් හීරුවොත් අපි එන්නත් ලබා දෙනවා. ඒකත් රජයට ලොකු වියදමක්. අපිට අවශ්‍ය වෙන්නේ ඊට වඩා එහාට ගිහිල්ලා සුනකයන්ගේම ජල බීතිකාව මර්ධනය කරන්න. ඒ කියන්නේ කෑවට පස්සේ ඒක මිනිස්සුන් ආරක්ෂා කරන එක අපි ඇවිල්ලා ද්විතීක කාරණාවක්. අපිට අවශ්‍ය වෙන්නේ සුනකයාගේ මතම මේක කන්ට්‍රෝල් කරලා ඉවරයක් කළා දාන. ඒක හින්දා මේ අලුත් වැඩ පිළිවෙලත් එක්ක අපි හිතනවා 2030 වෙනකොට ලංකාවේ කිසිම මරණයක් සිදු නොවේ කියලා අපි හිතනවා. ලංකාවේ පොඩි කාලයක් ගත වෙයි අපි ලංකාව ප්‍රකාශයටපත් කරන්න ඕන අපි මොකද්ද ජල බීතිකාවේ නිදහස් රටක් කියලා කාලයක් ගත වෙයි. හැබැයි අපි හොඳ වැඩපිළිවෙලක් තියාගෙන දිගටම මේ විදිහේ වැඩපිළිවෙල අල්ලගෙන ගිහිල්ලා මහජන සහයෝගයෙන් සත්ව නිෂ්පාදන සෞඛ්‍ය දෙපාර්තමේන්තුවේ සහයෝගයෙන් විශේෂයෙන්ම සෞඛ්‍ය අමාත්‍යාංශයේ සෞඛ්‍ය දෙපාර්තමේන්තුවේ සහයෝගයෙන් සහ පළාත් පාලන අය සහයෝගයෙන් සහ ක්ලීන් ශ්‍රී ලංකා සහභාගීත්වයෙන් සහ ඔවුන්ගේ ආශිර්වාදයෙන් අපි හිතනවා මේ දිවයිනක් වෙච්ච අපේ රටෙන් ඉතාමත් ඉක්මනට මේ ජල බීතිකාව තුරන් කරලා මේ පරිසරය විදේශිකයන්ට රටේ ජීවත් වෙන මිනිස්සුන්ට ඉතාමත්ම ආරක්ෂාකාරී තත්ත්වයක් උදා වේ කියලා අපි බලාපොරොත්තු වෙනවා. 2030 තමයි අපේ ටාගට් එක තියෙන්නේ. සමහරක් වෙලාවට මේ අවුරුදු 3ක් වගේ කාලයක ඇතුළත අපි ඔය වැඩපිළිවෙල සකස් කරලා මේ පටන් ගන්නකොට අපිට යම්කිසි මට්ටමකට එන්න පුළුවන් කියලා හිතනවා. හැබැයි අපි බලාපොරොත්තු වෙන තාමත් ඉක්මනින්. මොකද අපි දැන් අවුරුදු 70ක් තිස්සේ විතර මේ ගනුදෙනු කරනවා මේ ජල බීතිකාවත් එක්ක අපි එන්නත් කරනවා අපි වැඩසටහන් පවත්වනවා 1973 වගේ කාලේ ඉඳලා කැම්පේන් එකක් අරගෙන යනවා. ඉතින් මේක කාගවත් වරදක් කියලා අපි හිතන්නේ. මේකට වෙන්න ඕන සියලුම පාර්ශ්වකරු එකතු වෙලා හරියට ප්ලෑන් එකකට මේක ඉවර කරලා දාපු වෙලා අපි හැමෝම ආරක්ෂා සහිත වෙන එක.